Thanks. As the Wisconsin Department of Health Services continues its investigation into those 9 measles cases in Oconto County, Governor Tony Evers is sounding off on the first cases in the state this year. Taylor Zebel spoke with the governor during a stop today in Green Bay. She joins us live in the studio with details. Taylor.
Cami, Governor Tony Evers tells me this is serious business, and he, quote, wants to continue talking about it, making sure people make the right decisions, end quote. As we've been reporting, 9 people were infected with the measles virus via a common source while traveling outside of Wisconsin. The DHS saying they do not believe there are any public exposure locations and the risk to the public is low. Governor Evers visiting Brown County Oral Health Partnership Clinic today in Green Bay with State Department of Health Services Secretary Johnson. The two highlighting efforts to expand access to affordable health care in Wisconsin, which was promised in the biennial budget signed into law last month. Both state leaders reacting differently to the measles situation in the state. Would you say you're worried about
Yes,
this spread?
Of course. I was worried. Wisconsin has slowly moved, those numbers of people that have not been vaccinated get a little worse every year, and so we're just going to continue pushing it. But yes, I am concerned about that.
I think we will likely see additional cases, but I'm not particularly concerned about the cases in Oconto County. It's consolidated and very few exposures.
According to the CDC website, in 2025 alone, 1,356 cases of measles nationwide have been confirmed with 3 deaths. Cami?